Hello, Dr. James Bogash, expert in health and longevity. And so here we are again, a conversation that we've had over the past 3 years, and with an outcome which is exactly what we would have expected, but it seems like it was not. We wasted so much effort in discussion on things like masking and vaccination and this and that and all the antivirals and the anti-monoclonal antibodies, instead of looking at what we have always known that would work, and that is healthy lifestyle changes, exercise being definitely on the list. So this particular study was not specifically on COVID, but there is no reason to think that, despite what Twitter still seems to believe, COVID wasn't some miracle virus with like a cape and it did all kinds of new shit we'd never seen before. It acts much like every other respiratory virus. And so things like boosting your immune system is going to have the same positive outcomes on COVID versus influenza or pneumonia or anything. So in this study of over 500,000 people, so 577,000 people, following them for 9.2 years, they looked at exercise, both aerobic and weight training. There were some expected and then some unexpected results. They looked for people who died from either pneumonia or influenza death, and and I'll give you the real surprising, maybe not surprising statistic at the end, but those who exercised for 10 to 149 minutes, so basically up to 2.5 hours, so a little bit of exercise per week, and moderate to vigorous type of activity, 21% lower risk of dying. Like this is a pretty specific endpoint, right? Not hospitalization, not anything, like dying. Those who exercised aerobically between 300 and 600, so about 5 to 10 hours, had a even lower risk. But when those people who were exercising in that 5 to 10 hours category also did at least 2 days of strength training, they had a 47% lower risk of dying of COVID, so almost half. Interestingly enough, so here's a couple interesting statistics, is that just like everything else with exercise, we know that like marathon runners, it's arguably that, or easy to argue that we are actually doing more damage, like a bell-shaped curve. And so sure enough, in those people that exercised, first of all, they're aerobic more than 10 hours a week, there were no additional benefits from there. No harm, but no additional benefits. But for those who did muscle training 7 days a week, 7 or more, had a 40% higher risk of outcomes. There's certainly some reasons for that. Generally, muscle building is good, but you're not giving your body some time to recover. So I think the most disturbing thing I found in this study was, out of over 500,000, 577, half of them didn't even meet the target of like 10 hours a week or doing any strength training. I don't even know what else to say. We need to be moving, regardless of what outcome you're looking for. Exercise plays a massive role in everything. Longevity, in disease states, in heart disease, in stroke, in cancer, quality of life, everything. And if half the people in this study are not exercising, you can pretty much guarantee that going into the pandemic, that number did not get better, it probably got worse. And as I have said consistently, my frustration with all of this is we had a pulpit, we had a microphone, we had a bullhorn to educate people about how important it was to move and make better choices. We did none of that. If anything, it was a side note in like 0.8 font. Everything else was about stuff that might have a minimal impact on your risk of COVID, and that hasn't changed. As a society, we still think that it's okay to not be moving, or at least we're accepting of the fact that we're not moving, and that can't be it. We can't live our life thinking that not moving is a good thing, because it's not. As always, I'll post a link to this particular study in the description. Make sure you like